त्रिनयनां माणिक्यमौली स्फुरत् तारानायकशेखरां स्मितमुखीमापीनवक्षोरुहां पाणिभ्यामलिपूर्णरत्नचषकं रक्तोत्पलं बिभ्रतीं घटस्थरक्तचरणां ध्यायेत् परामम्बिकाम् सततज्वर विषमज्वर ग्रह नक्षत्र दोषाञ्चान्या हर हर काली सर सर गौरी गम विद्ये आले माले काले बन्धे भज भज विद्ये मख मख विद्ये नाशय नाशय पापम् हर हर दुःस्वप्नं विध्वंसय विध्वंसय
And a warm welcome to all our participants for the third session on the 23rd day of Global Festival of Yoga being organized by Indica Yoga. As you all know, Indica Yoga is a platform that offers inclusive and diverse forms of yoga, which is authentic, immersive, and transformative in nature. And today, we are extremely pleased and honored and privileged to have with us Dr. Lorenzo Cohen. May I now request Dr. Cohen to kindly come on the screen. And I also would like to request Smita Mallayya ji, who is also one of our members of our anchoring team, and she's also one of the presenters who was already with us, to kindly come on the screen and to co-host this session.
Namaste, Vinay ji.
Welcome, Dr. Cohen, and welcome, Smita ji.
Thank you. Thank you for having me.
So I also would like to welcome all our participants. They have been with us for almost 23 days and they're participating and contributing to this whole deliberations that are taking place. So I now request Smitaji to introduce Dr. Cohen. Smitaji, as you know, she was already a presenter on our then in the first week of our festival. She is a senior mind-body intervention specialist at the University of Texas MD Anderson Cancer Center, Cancer Center's Integrative Medicine Program. She's also the program director at S. Vyasa USA Houston Center, and she will be co-anchoring this session. And Dr. Lorenzo Cohen will be speaking on a very pertinent topic that we have been discussing in last couple of days, how to get into the integrative medicine, which is the way of the future. Yesterday we had Dr. Rajiv Vasudevanji speaking on this subject from the Ayurvedic perspective. And today we have Dr. Cohen, who will be presenting from the modern science perspective, and especially from the basis of the research that has been done at MD Anderson Cancer Research Institute. So with this, I now request Smitaji to introduce Dr. Cohen.
Thank you, Vinayji. It is indeed an honor and a privilege to introduce Dr. Lorenzo Cohen to all of you on this platform today. Dr. Cohen is the Richard Haynes Distinguished Professor in Clinical Cancer Prevention and Director of the Integrative Medicine Program at the University of Texas MD Anderson Cancer Center. Dr. Cohen is conducting research to demonstrate that lifestyle factors, including healthy diet, physical activity, stress management, and social support, in other words, basically leading a yogic lifestyle, can influence cancer outcomes. As we know, yoga, when practiced in a comprehensive manner, including asana, pranayama, meditation, diet, and social consciousness, will have profound effects on all aspects of life. In fact, lifestyle factors are increasingly being recognized for their role in non-communicable diseases like cancer, heart diseases, diabetes, and others. So yoga plays an important role for cancer patients and caregivers alike to improve the aspects of quality of life and possibly even clinical outcomes. For those who need evidence of the impact of traditional medicine and yoga to deal with cancer, one does not need to look any further than Dr. Cohen's work. He conducts research examining the biobehavioral effects of integrative medicine practices aimed at reducing the negative aspects of cancer treatment and improving quality of life in cancer patients. He has conducted studies in the area of meditation, Tibetan yoga, Patanjali-based yoga, or what we call as the Ashtanga yoga, including the aspects of philosophy and practice, Tai Chi, Qigong, and other strategies such as stress management, emotional writing, neurofeedback, and acupuncture. Dr. Cohen is also the grandson of the late Vanda, who is the author of Awakening the Spine and a yoga teacher of many. She herself was a disciple of J. Krishnamurti, Sri B.K.S. Iyengarji, and Sri T.K.V. Desikacharji. And most importantly, with his decades of work, Dr. Cohen has brought out the mix of six, a theory propounded along with the co-author Alison Jeffries, points out that while most people believe that cancer attacks people randomly and that one cannot explain why someone gets it and others don't, there are six factors that are part of mix of the six of cancer prevention and care. And most importantly, I personally have seen Dr. Cohen as the man who walks the talk. So he himself practices yoga, pranayama, every day regularly, meditation, all aspects of yoga, what he calls and propounds as the yogic way of lifestyle. So it is indeed an honor to have you here today for our presentation. And without any due delay, I will hand it over to Dr. Lorenzo Cohen for his presentation. Welcome, sir.
Thank you. Thank you, Smitha, for the wonderful introduction. I hope I can live up to even just some of those words. I wish I'll have full disclosure here that currently I'm not practicing yoga every day. but I will make no excuse. I have plenty of time. I have the ability. I have the location. This is something maybe we can get into in the question and answer session. Why is it, as I'll talk about, as Smita mentioned, this mix of six? Why is it that this one aspect of the mix of six seems to be so challenging for us to incorporate into our days? But I don't want to get ahead of myself. I want to thank this organization for doing this 30 days of focus deeply and across the course of the day. If you look at their schedule, there's a number of different sessions every day for 30 days, which is fabulous to see. So what I'm going to be talking about today, let me see if I can share my screen now.
While Dr. Cohen is getting up his slides, we encourage all the participants to put in your questions in the Q&A box, and we will get Dr. Cohen to look and answer them by the end of the session. Thank you.
Yeah, questions to me is always the best part of these things. So I look forward to meeting and hearing from many of you. So Smita mentioned this book that I wrote with my wife, Allison Jeffries, Anti-Cancer Living, Transform Your Life and Health with the Mix of Six. And we'll talk briefly about the 6 factors, but today, because of the audience, feels a bit like Coles to Newcastle, but I thought I would get into some of the research and actual data that exists on the benefits of yoga and how yoga can truly be life transformation. We call it the mix of 6. This is also just for those who English isn't your primary language, and those of you in India, this is the version of the book that's accessible through India, England, etc. The mix of 6 you see here, I'm not going to read what these factors are, but as Smita mentioned, really, when you get deeply into yoga and you understand, the purpose of yoga and the true practice of yoga, what I call yoga with a capital Y, you are leading the full mix of 6. You don't have to think about them as something separate. Although today, when we talk about yoga, we really put them into these first 2 components of love and support and stress management. But when you're leading a yogic way of life, you're eating an appropriate diet, you're exercising appropriately, you're ensuring that you're living in a clean, toxin-free environment. Sleep comes along for the ride because you will be sleeping the appropriate amount. So to bring this comprehensive lifestyle change program to our patients at MD Anderson, we frame it in this way. Because unfortunately in the West, as many of you know, when we think about yoga, we think about stretching, breathing exercises, and meditation. And many people, unfortunately, often leave off the meditation. We're, in some sense, stuck in, just the, I think it's the 3rd and 4th limb of yoga from Patanjali's Yoga Sutras, and forgetting that there is this whole larger comprehensive approach. So I'll touch on diet and physical activity, but literally one slide, and we'll really go deeper into this area of yoga as a way of life. Now, this is nothing new to our world, and luckily now, there are some positive things that we see coming out of the SARS-CoV-2 pandemic that unfortunately results in the COVID-19 disease that so many people are suffering from. But one of the positives is this acknowledgement and recognition that we need to take care of ourselves, that we need to take care of each other. And luckily, this, what is colloquially called this mindfulness revolution, had already been happening. And as this has been happening around the world, they say now that there's more yoga studios in Manhattan than there are Starbucks. And, you know, is this good? Is this bad? Well, you know, ultimately, I think this is good. If people walk in that front door because they think they're going to be able to relax and to manage their stress, well, that's a start, because we know that stress is essentially toxic. And here you see a pictorial view of what we can call the stress response that, of course, starts with our brain and how we process events and situations in our brain. If we view them as threat or challenging, or even representing loss, that can ultimately result in fear and anxiety, we get this cascade of stress hormones. Now, for an acute period of time, this cascade of hormones is very good. It's very adaptive. Evolutionarily speaking, I would argue that we have evolved from individuals who had a very acute, sensitive stress response. When you heard the rustling in the bushes, you quickly process that information and were able to fight or flee, the fight or flight response. This acute stress response allows us to mobilize, allows us to quickly scan a situation and then respond. Increase in heart rate and blood pressure, increasing these stress hormones, a shunting of blood from the periphery into our muscles. We actually get a speeding up of platelet clotting time. And you may think, well, why is that important? What are platelets for? Platelets help our blood congeal, and it's very important to have very functional high platelet levels if you cut yourself. And you can imagine how that would be good if you're in the middle of a battle for your life. There's also a change in the shape of the cornea so that you can see long distances better. And you obviously can understand why that would be good if you're living on the savannah and you want to scan your environment for danger. So this acute stress response is very useful. It's very adaptive. But this acute stress response is exactly the same response that happens when it becomes chronic. So day after day, you're flooding your body with these stress hormones. You're sitting in traffic and you're having your body flooded with hormones that are going to allow you to fight or flee. Well, you're stuck in a car in traffic, getting angry and getting upset and having this acute stress response that you do day after day. So therefore, it ends up ultimately becoming a chronic response. It's not very adaptive. It's not going to help you get out of traffic. Same with sitting at your computer and you are stressed because of work or because of something that's going on in your life and you're staring at this computer screen. This stress response that was adaptive, evolutionarily speaking, is no longer adaptive for us. And because we have this wonderful prefrontal cortex and we're able to imagine and picture things in the future and remember things and picture things in the past, we are also unique on this planet that we continually relive stressors that are no longer stressors anymore. And worse, we picture a dangerous future, which even hasn't happened yet we're experiencing this acute stress response, even for things in the future that haven't happened. So we need to get a handle of this, because this is something that is actually quite damaging to us. So I'm going to show you some data that hopefully you will leave pretty convinced of the harms of stress. And the key is, well, what do we do about it? Well, it's very hard to study stress in humans, because we can ask them how they're feeling and we can look at different situations, but you can't do it in a formal randomized way, which is the hallmark of determining true cause and effect. But we can, under appropriate situations, use mice. And in animals, we use mice before we move into humans to try and understand a phenomena. And Anil Sood at MD Anderson, a wonderful scientist, gynecological oncologist, published this, what is now moving into a historical paper, but really a landmark paper, showing not only that you see here in these second two bars than animals who were injected with multiple different ovarian cancer cell lines in multiple models. Their tumors were much larger, as you can see from tumor weight. But we also see here on the right that the spread of the disease was throughout the body. And the animals who weren't exposed to stress had much smaller tumors, tumor confined to the site of injection. And we'd known this from Sklar and Annesman's work up in I think they were at Waterloo in Canada, that stress caused progression of disease in multiple cancer models. But what we didn't know was how. And what you see on the bottom two bars are the animals who had the same stress as the second group of animals there, but they were given a beta blocker. They were given propranolol, which is a pan-beta blocker, but in particular blocking beta-2 receptors. And if we go back here to this prior graph, we see the noradrenaline, and this is British publication, but it's essentially norepinephrine. And when norepinephrine goes up during acute stress, it's actually getting into the tumor microenvironment and binding and activating tumor growth. So stress is literally causing progression of disease. This has been replicated in multiple animal models, and I'll show you some of the clinical data as well, although that's, again, epidemiological in nature and much harder to determine pure cause and effect. So what you see pictured here is, everyone's familiar with the beautiful chromosomes that are in every single cell of our body. On the cap of our chromosomes are what are called telomeres, and you see that pictured here in pink. Telomeres, if you could think of a metaphor of the shoelace, and on the shoelace is what's called the eyelet, which is the tip of the shoelace, maintaining the integrity of that shoelace. If that plastic comes off, then the shoelace starts to fray. Telomeres are the exact same thing, but on our chromosomes in every single cell of our body. And as we age, we get what's called telomere attrition. And if the telomeres get too short, we get what's called chromosomal instability. And one of the hallmarks of cancer is this chromosomal instability. So one of the reasons why cancer, at least historically speaking, until recent era, has been a disease of more advanced age is because of this telomere attrition that happens. Again, just part of the normal aging process. The speed at which your telomeres shorten, however, it could be seen as a biological reflection of your. What Elizabeth Blackburn, Nobel Prize winner for medicine, for her work in telomeres and an enzyme that's in the nucleus of the cells, telomerase, did with Alyssa Eppel, psychologist, UCSF, was examine the relationship between chronic stress and telomere attrition. And in fact, they found and have replicated now in multiple models that chronic stress leads to telomere attrition. So essentially what that means is chronic stress is speeding the aging process. So when we look at some of the clinical models, and I'll just show you a few of these, we see that one of the hallmark symptoms of chronic stress responding, in particular in oncology, is depression and depressive symptoms. And we've done a number of studies in this area. Others have shown, and we see this in multiple models of cancer, in lung cancer, prostate cancer. Here's kidney cancer, the most research done in breast cancer, that people who have poor mental health, increased anxiety, increased stress, don't live as long. In this study, we mapped a different stress hormone into the model, cortisol, and showed that when there was a lack of normal circadian rhythm in cortisol, this was an independent predictor of survival. And depression, of course, led to dysregulation of cortisol rhythmicity. But we're also able to show is to go in and look at genes and look at different gene regulatory pathways and comparing the most depressed to the least depressed. And we're actually able to see that genes for controlling inflammation, the immune system, and negative regulation of programmed cell death, which is apoptosis, were all upregulated. So meaning that there was increased inflammation, worse immune response, and decreased apoptosis. And we saw downregulation of genes involved in cell trafficking, adhesion, oxygen transport, and hemostasis. Very importantly, we went into the tumor microenvironment and compared histochemistry, as you see here, between, again, the depressed and the least depressed. And those who had the highest depression scores actually had the highest infiltration of macrophages. And macrophages actually help to activate and make the tumor microenvironment more hospitable to cancer growth, as well as some other regulatory and inflammatory pathways. We showed in a separate study that, and this was a group of bladder cancer patients, not only were the depressed patients not living as long, but we were able to map that onto short telomere length. The more the depression, the shorter the telomeres, the earlier the death. Now, let's talk about something positive, which would be, some of the factors such as love and support and connection. Do we see in the literature that those are related to better outcomes? And in fact, well, sorry, one more slide on the bad, which is depression here, and norepinephrine. This is a beautiful work by Susan Lukendorf, University of Iowa, along with Anil Sood and others. And we see here that the patients with a higher depression had higher levels of norepinephrine, literally in the tumor microenvironment. So again, this is an explanatory reason for the disease progression. And we see here really no difference for plasma levels, meaning norepinephrine in the periphery. So the action, of course, is happening in the tumor microenvironment, whether the disease is progressing or not. Importantly, we see, the positive side of things, which is those who had higher social support, better socially attached individuals in their environment lived significantly longer. And we can also map some of these more positive aspects of psychosocial well-being down into genes and down into the tumor microenvironment. Here's one example: vascular endothelial growth factor. Again, one of the cancer hallmarks. It needs a blood supply to allow it to grow and thrive. And cancer cells, unfortunately, are able to trick our system, and they form their own vascular system within our body. And that's called VEGF, vascular endothelial growth factors. As that goes up, the ability to form its own vascular system goes up. And what we see here is that as social well-being, social support go up, we see that this factor actually goes down. So just something like love and support is leading to a tumor microenvironment that's less hospitable to its own growth. I came across this fascinating study just the other day with my kids. We are participating in this Coursera course called the Science of Well-Being. And it's a wonderful course to kind of take you on this journey of well-being and happiness from a deeply scientific perspective. And I'd never heard of this study, and I thought I would share it with everyone today, which really talks about social support and the importance of social support. So as you can see in that first bullet, we've known that connecting with others and people in our environment and being close with loved ones and having connection is really important, again, all the way down to how our genes behave. But with strangers, we tend to not make those connections, and we actually, teach our children, unfortunately, because of the real dangers in our world, this phrase of stranger danger. When we get on public transportation, which most people haven't done recently, but when you get on the bus or the subway You tend to put on your headphones and look down into your phone now more than ever. But even historically speaking, before even smartphones, people tend to create their own little world. They create this bubble and they think that, you know, this is something that's probably better and will make them happier. And the question is why? You know, either this form of solitude maybe is a more positive experience than interacting with strangers, or that, you know, people just in general misunderstand the consequences of these distant social connections. So Epley, the University of Chicago, and colleagues did this fascinating study. They did a series of 5 studies. I'm just going to quickly describe this one, which is they approached people on the subway track before they got in the subway train, and they asked if they were willing to participate in the study. And they asked them, they were in one of 3 groups. One group was asked, when on your commute in, you need to befriend somebody and have a conversation and learn as much about them as you can and share as much about yourself that you're comfortable. They then had a condition that we're told to create solitude, which is probably what most people do. They didn't have to be told that, and don't talk to anybody. And then the third group is do whatever you would normally do. And they first asked them, what would you predict based on knowing what these 3 different groups are? And not surprisingly, we see, oh, I don't see my legend there. But the far right bar is actually showing the people who were in having to connect. That if they had to connect, they would have a decrease in positivity. And then you see the group that were the control group, the new, you know, to do whatever you want. And then the third group there in open bars is the solitude group. But when they actually did the experiment, we see that those who were told to connect afterwards, and this was, you know, later in the day, they had much more positivity, and those who were forced to be in solitude had the worst level of positivity. So this is a fascinating example that even connecting with strangers leads to better well-being. Now, evolutionarily speaking, we are social beings, and connecting has been very adaptive for us. And it seems most likely that even connecting with strangers ultimately is adaptive for us. And something that we need to do on a regular basis. So these psychosocial factors, things like depression, social support, love, connection, and even going deeper, things like purpose and life, have an impact on, of course, our brain, which then has this downstream effect on our body, all the way down into how our genes are behaving. And in the world of cancer, importantly, influencing the tumor microenvironment. I'm not going to go into any of the details that you see on this slide, but suffice it to understand that cancer needs a number of different biological processes to be activated, and usually more than one, to be able to grow and thrive in the body. We all have constantly mutating cells in our body. The question is that mutating cell going to turn into a malignancy that grows and ultimately threatens our lives? So all 10 of these things that you see listed here are things that, when they are functioning properly, help to maintain a mutating cell in check and doesn't allow cancer to grow. If these things activate, if you have a suppression in your immune system, if you have excessive telomere attrition, if you have too much angiogenesis, if you have too much inflammation, and if you have multiple of these factors, then that initially mutated cell has a very high probability of growing and ultimately forming into a cancer that threatens our life. Chronic stress activates, means making them more functional in the body, all these cancer hallmarks, making us more vulnerable to initiation of disease, but more importantly, once that mutated cell happens, again, which is just happening naturally, and then there's, of course, carcinogens that can cause damage to our DNA, leading to a damaged cell. But even if you're exposed to a carcinogen and that damaged cell replicates once or twice, If the cancer hallmarks are working properly, then it will be put in check and that cell will be killed. But if the cancer hallmarks are activated in a negative way, then the tumor is going to grow and thrive in our body. So we need to clearly get a handle on this. And we need to get a handle on this now more than ever, because as a world, we are experiencing chronic stress. And I thought I would just share a little bit of, in some sense, hot off the press. This is a month ago. So in the world of COVID data collection, this is ancient. If you're following the literature, it's really quite out of control. But this study was interesting because they compared individuals who were part of this database where they had measures like psychological distress and loneliness a year ago and then now in April. And we can see overall symptoms of psychological distress going up quite dramatically, although it's still somewhat of a low level, but that is a concerning increase from 40% up to almost 14%, and probably in some places even more now. And this is, overall, interestingly, there wasn't an increase in loneliness, which, may not be surprising because people in a strange way are connected now more than ever. The fact that I'm doing this lecture to you now probably never would have happened if we weren't experiencing this world pandemic and appropriate lockdown in some countries and inappropriately not locking down in countries where they should be. But we've been able to stay connected due to the ingenuity of human beings. I'm not going to go through this whole slide, but you can see, some of the factors that are predicting more distress. And unfortunately, that young age group, 18 to 29, which anecdotally we've known, but here's the data showing they, in fact, are the most distressed in this situation. And then the social gradient of health, minority and underserved, et cetera, that you can layer onto this. So now more than ever, we really need to start engaging in things that will help manage our stress. So, this one doctor is saying to the patient, the best way to manage your stress is you need an easier job, smaller house, and a different family. It's very odd sharing jokes on Zoom because I can't hear everyone laughing. Hopefully, at least some of you are smiling. And in fact, those of you who have a family know that this is probably true, but not something that we can prescribe. But there are, from a psychosocial perspective, so many different things. Mind-body programs that are conventional in nature, cognitive behavioral therapy, both individual and group, and then the more Eastern-based practices, what we call the mind-body practices that we'll focus on today, in particular, getting into some detail on yoga. So Smith shared with you a little bit about my background and pedigree. My grandmother, you see pictured here, Vanda Scaravelli. I spent essentially every summer with her, except for 3. She lived both in Florence and in Rome, but we primarily spent summers in Florence, and then lived with her for a full year in between undergraduate and graduate school to, in particular, learn yoga from her. She was also concert level pianist, and a close friend said to really deeply get to know your grandmother, you either need to take yoga from her or piano lessons. And I chose to do both. I didn't really learn much in piano, but it was that process. And in fact, it was quite interesting to see how she taught both these things, which seemingly are totally different, but she took a very yogic approach to teaching piano as well, about posture and about breath and about intention. And so that was really a formative experience for me. She had what she calls 3 teachers, one for the mind, one for the body, and one for the breath. And you see here the brilliant Krishnamurti, philosopher, and he really influenced her from that mind perspective. Every summer, she would spend time with Krishnamurti, and for his yoga practice, they brought in BKS Iyengar. This is how she was introduced to the physical side of yoga. And as you can see here, the very physical side of yoga with Iyengar on top of Vanda doing Paschimottanasana. And for the breath, Desika Char, who who really goes deeply into the pranayama practices. And of course, the lineage comes from Krishnamacharya, who is the father of Desikachar and father-in-law of BKS Iyengar. So when I first started at MD Anderson, really my yoga focus in some sense came from this tradition. And early on, this, for those of you who know, Dr. Nagaratna, she's relatively small, petite woman, and she walks into my office and says to me, "You need to do yoga research with us." And I didn't know who she was. I'd never heard of this yoga university, SVASA, but it didn't take long to learn by going to PubMed. And this was back in 1999. And even at that time, they were the formidable yoga university in the world, doing specifically medical research with yoga. Their first study published in 1985 in the British Medical Journal showing that yoga could help to treat asthma symptoms. So, you know, after not doing a lot of thinking about it, we teamed up and have been working together for now multiple decades in the area of yoga research. And being at MD Anderson, of course, the focus has been primarily in oncology. They have, I'm just going to share a couple of their prior work, have been incorporating what they call the Integrated Yoga Program. What in our first publication, the first time we wrote it, the term was Hatha Yoga, and of course they appropriately said, well, this isn't Hatha Yoga, this is yoga. And I said, well, you know, in the West, we need to call it something. We call it, you know, Hatha Yoga is what people know, or relaxation yoga. Well, we need to name it. And they said, well, let's call it Patanjali-based yoga, which in fact is the term that we use in all of our work. Here, they're using the term Integrated Yoga Program, but it's essentially this comprehensive yogic model that includes not just asana meditation and yoga, but also this more comprehensive approach. This was a study in breast cancer patients who are undergoing radiotherapy, and they actually looked at DNA damage. We know that radiation causes DNA damage, and that's one of the ways that it's actually affecting the slowing of progression of disease, but you don't necessarily want to have that happening around your whole body. And these first bars here show, you know, beneficial effects of yoga. It's the open bar here on measures of mental health from pre to post. But most importantly, we see here in the far end is DNA damage. So DNA damage is going up tremendously in both groups, but much less if they were in the yoga group. So that yoga was in some sense protecting the patient from the harms that the radiation was causing in general in the periphery, because these were blood samples taken out of circulation. They've also looked at yoga during chemotherapy and showing multiple symptoms improving relative to a control group in terms of the frequency of nausea, intensity, even tackling anticipatory nausea, which is the conditioning that happens where you're starting to feel nauseous even just on your way to the hospital. So we've done now a number of different studies, but most recently that we haven't analyzed all the data, and we're deeply into data analysis right now, an N of 450 breast cancer patients using this similar model that I'm going to describe now, but this was what we could call the pilot study, although a pretty healthy pilot study of around 50 per group that you see pictured here. Importantly, we had a control group that did some basic stretching exercises. So a lot of people who are skeptical about the benefits of yoga, and actually I had embarrassingly, a breast medical oncologist, when I presented some of this data to their faculty, who blurted out in front of all the faculty, and I thought quite embarrassing for him, that yoga is just placebo. And actually, I didn't even know how to respond to that kind of crazy comment based on the mountains of literature that already existed. Luckily, his own faculty kind of attacked him on that lunacy of a statement that was not embedded in science. But is yoga's benefit just something around the physical? Well, that hasn't actually been researched because there hasn't been this kind of an exercise, or in this case, a stretching control group. And the stretching control group did things that were very similar to the yoga movements, but not done in a comprehensive manner, not focusing on breath, not focusing on mind. You can have your chattering mind, writing emails, doing whatever you want while you're doing the basic stretching exercises that you were taught. And then we have controls. Patients were tracked for 6 months, as you see pictured there. So physical functioning this is a measure of ability to engage in daily activities. And we see, not tremendous differences around the end of treatment, although improvements for both yoga and stretch. But then it's really over time where we see benefits for the yoga group, and the stretch group just falling in the middle there, and only meaningfully different from the controls at that 3-month time point. So really, favoring the yoga group. And the controls really not getting any better over time. And we have to remember that entry point here, this is change scores. So change from how they're feeling at the time of the start of radiation, which for most of them is after 6 months of chemotherapy followed by surgery a month earlier. So we're really helping these patients to recover and to get, feeling better again. Just a measure of general health following that same pattern. And to me, probably the most important finding is this measure of benefit finding, ability to find meaning in the illness experience that we see dropping over time in both the stretch and control group, and maintaining a level better than they were coming into the study, even at the 6-month time point. This is a measure of purpose in life, meaning in trauma, etc. So getting more into the deeper psychosocial nature of things. So we looked at cortisol rhythm. I mentioned this on the kidney cancer study. You see here what cortisol looks like. This again is a common stress hormone measure from the saliva 5 times a day. Starts high. So for us in North America, we're somewhere around here. And then throughout the course of the day, it drops. And for all of those listening from India, you're probably around here and starting to get ready for bed, which is when it's at its lowest. So the steeper the slope, that's a prognostic indicator of survival in breast cancer, kidney cancer, and other cancer models. It means that you have a cortisol rhythmicity that is working well, the diurnal nature of cortisol. What we see here is the end of treatment, and we see a blunting of the cortisol slope. It's not going down as far at the end of the day. In fact, in all groups, if we toggle back and forth, we see that is the case for all the groups. But the yoga group maintains the steepest slope compared to both the others, both at the end of treatment as well as 1 month later. So we're seeing not only benefits in terms of quality of life and purpose and meaning in life, but also better stress hormone regulation. My colleague, Catherine Milbury, has been working with us, and she started as a postdoc, and now she's launched for her own independent research career. But luckily, I have infected her with the yoga bug, and she is now focusing her laboratory in bringing yoga to the dyad, to the couples. Cancer is not an I experience, it's a we experience, and it affects the whole family. And so she's teaching yoga to both the patient as well as the caregiver, and doing it in a comprehensive manner. some very exciting data that she's going to have published very soon. I'm just showing you the objective measures, so not things like paper and pencil quality of life, but the patients these were lung cancer patients undergoing radiotherapy from, you see there, the end of treatment to 3-month follow-up, that there's an improvement in the 6-minute walk distance test, and very importantly, dyspnea, which is shortness of breath. There was, of course, a worsening in the control group, and the patients were in yoga had better measures for shortness of breath. So again, we're seeing physical benefits as well. In collaboration with Dan Hauer and colleagues, we did a systematic review of yoga for oncology, and in a book that I helped to co-edit, there was so much research on yoga and cancer that we needed 2 separate chapters, one for patients undergoing active treatment and a separate chapter for patients who receive yoga as cancer survivors. And you can see here the clinical trial increase over time in terms of yoga specifically in cancer patients. Most of the research has been done in cancer survivors, where we see improvements, as I just shared with you, in aspects of quality of life, physical aspects of well-being, psychological well-being, cognitive functioning, and in some cases, improvements in biological measures. I mentioned cortisol, but there's also been benefits in terms of immune function, some wonderful research showing less telomere attrition for those who are participating in yoga. Where I see that yoga is now really being accepted, and hopefully the medical oncologists of the past, who I shared with you that one comment, is in the rear view mirror, is when yoga is accepted as the standard of care. And although it is not the standard of care and paid by insurance yet, what you're seeing on the slide now are the NCCN guidelines. This is the National Comprehensive Cancer Network, made up of all the comprehensive cancer centers, the cancer centers that are funded by the National Cancer Institute at the NIH. MD Anderson, of course, is one of them. There's around 80 comprehensive cancer centers in the country, in the United States. And they have an organization that develops guidelines. And the guidelines are for treating breast cancer, or for treating fatigue, or for treating prostate cancer. There's guidelines essentially for everything. Now, luckily, there's guidelines for diet and exercise. But if you look at the anti-emesis, meaning to help control nausea guidelines, in particular anticipatory nausea, you see yoga. Yoga is listed there essentially as A-level evidence. I think they have the caveat if approved by a physician, because there are some contraindications of doing yoga, in particular with advanced cancer, if you have bone metastases and fear of fracture and things like that, and that has happened. So we've made it to prime time being on the guidelines. It's also here for fatigue, again, category 1, meaning top level evidence, yoga for a treatment of cancer-related fatigue. And when we look at pain, there's a number of different mind-body modalities. They list MBSR in particular, but of course, MBSR has just been the most researched form of meditation, but it's essentially saying meditation, and meditation, of course, falls into yoga. Another acknowledgement of the acceptance, let's call it, of yoga in oncology care was this special issue of the Journal of Clinical Oncology that I helped to publish, which reviewed the SIO, Society for Integrative Oncology, guidelines for integrative medicine for breast cancer patients, in particular mentioned yoga for anxiety, stress reduction, depressed mood, and just improving overall quality of life. ASCO and the JCO are the journals of the world of medical oncology. So all of this in the cancer world is put together in 2 chapters in this wonderful book I had the honor of co-editing with Satbir, Timothy, and Shirley Tellis. And there's 17 different disease chapters. There's chapters as part of every chapter on practice, etc. So this is a wonderful textbook that takes you through the research and the science. Essentially, there's, again, 17 different disease sections: cardiovascular, women's health, endocrine, etc. There is so much research on the role and application of yoga in healthcare that this really does need to be the standard of care. Now, one of the challenges, it says Western yoga, but I would argue that it's no different in the East. People want the quick fix. People do not want to have to spend 10, 20, 30, ideally 60 minutes a day engaging in this type of a mind-body practice. And in fact, if there was an audience that I could interact with now, I would ask the question about, you didn't hear enough about beta blockers, but those little animals were given beta blockers. If we look at the data of people with cancer taking beta blockers because they have heart disease or some condition, and you look at essentially any cancer that has been looked at: ovarian, breast, prostate, lung, head and neck, the list goes on. Patients who are taking a beta blocker, patients who are blocking the effects of norepinephrine, that stress hormone, lived longer and had a lower probability of recurrence of disease. So blocking the stress hormones, as you've heard, is good. So, do you want to have, and we know that engaging in yogic practices will also similarly decrease that stress hormone norepinephrine and decrease its binding capacity in the tumor microenvironment, etc. In one case, you have to do this practice an hour a day and engage in healthful living and positive interactions with people and managing your stress. The others just take this pill. I'm guessing that, most of our society, unfortunately, would say, just give me the pill. Ideally, why don't you just put it in the water system like we do fluoride, so that nobody has to even bother taking the pill, and we'd have a more relaxed society. Well, of course, beta blockers are a drug that are potentially harmful, and for in particular long periods of time. Any of you who've tried to exercise on a beta blocker know that that's extremely difficult because you're not getting that rise in stress hormones to allow you to mobilize. So you're probably not getting the beneficial effects actually of exercise. So we need to turn to the yogic way of life. And this is a study that we've been doing. We've actually recently completed in analyzing the data in 100 breast cancer patients undergoing radiotherapy. And like our past research, not just providing guidance on yoga and mind-body practices, but looking at yoga in a more comprehensive way and including diet and dietary advice, exercise, social support, what we're calling yoga with a capital Y. And we know that exercise is linked with the risk of a number of different cancers, or sedentary behavior, the lack of exercise. And you can see that list here. We know that eating a more plant-centered diet leads to lower risk of cancer. And just those 2 factors combined with a healthy weight reduces your risk of all cancers by 30%, and some cancers like colon cancer by 50%, endometrial cancer by 70%, by just focusing on those 3 areas and maintaining those in a healthful manner. And both diet and exercise activate all the cancer hallmarks, meaning that if you don't exercise and you eat an unhealthy diet that's filled with animal proteins, in particular red meat, that you are going to stimulate cancer growth in the body. So in this study, we're really teaching patients this comprehensive approach, and not just yoga and exercise and nutrition, but importantly also behavioral counseling. And it wasn't behavioral counseling from, lie on the couch and tell me about your problems. It was specifically around how to integrate this into their lives. They engaged in 2 sessions a week of mind-body exercise and nutrition, and once a week with the counseling for the 6 weeks of radiation. And then they had regular meetings for the subsequent year with the behavioral counselor to help them incorporate this into their lives. And, all the women in the study who, to be in the study, you needed to be overweight to begin with and not following some of these guidelines. They were all had tried diet and exercise and different programs, but none of them had engaged in a mind-body practice. And this was the area that I just knew anecdotally and at a personal level and interacting with people, that this was always the missing component in lifestyle interventions, in particular for weight loss. They forget that the patient's environment really matters, and in particular the patient's own stress levels and how stress can interfere with engaging in healthful living. And essentially all of the women talked about how important the mind-body practice was. And one quote in particular always rests with me, was that through meditation and deep relaxation, my answers were flowing. The prior sentence was that, you have all these questions inside you that are locked up, and that through meditation and deep relaxation, she was essentially finding her meaning and purpose. So when we talk about these different areas of the mix of 6, it's all ultimately about the synergy. And that's really what yoga with a capital Y is. It's about the synergy of how we lead our lives. And the more of these factors you have going, the better. And it's easier not even to talk about them as separate things, and really just as the synergy. So the last part I really want to get to and just talk to briefly, because I know we're at the end, is getting a little off the physical and into the non-physical side of yoga, and what we in the West call the biofield, and things like chi, and from the Indian tradition, of course, prana. Well, what is prana? Well, we call pranayama, and so it's breathing exercises. It's not. It's that energy. It's that flow of energy through the body. And yoga would actually fall under, if we think about it, not from a biopsychosocial perspective, but from an energetic perspective, into what would be called biofield interventions. They're typically internally done, meaning our own self-practice, versus external kinds of biofield interventions, things like Reiki, therapeutic touch, healing touch, where somebody's purportedly sending their prana, chi from their body into your body for healing purposes. Others have gone into the details of the koshas, but of course, we tend to focus most of our lives in the yoga world in the first 2 sheaths. And of course, now we're talking about moving further out into the bliss area in terms of this universal energetic connection. And I'm grateful to Raghuramji, who has shared this slide with me. And we see there the different definitions of yoga, but the most beautiful one is joining the individual soul to the universal soul. So this is really, looking at it from this energetic perspective, that there is, of course, this original source of energy, which was the Big Bang, and everything is connected to that original source of energy. So I met this individual you see pictured here, Sean Harabance, about 15 years ago, and we started a collaboration. In particular, he's known as a clairvoyant, as somebody who can see things that haven't happened yet and know things about your past that you kind of wish he didn't. And To me, that's in some sense a parlor trick. It's interesting to him as well, not something that that he tends to focus much on, but he was deeply interested to see if he could do something with this energy for healing purposes. And we've now published 2 studies with Mr. Harabanz showing that this form of biofield therapy, emitting energy from one person into, in this case, animals, because of course it can be very well controlled, clearly shows that there was a biological effect. Here you see the growth of the tumors in these animals who were injected with lung cancer, and we see much more rapid growth in the control animals compared to the experimentals that was growing, but much slower. If we look at the tumor volume on the left, the tumor weight on the right, much smaller tumors of the primary site. And importantly, if we go in and look at the tumor microenvironment, we see dramatic things that are different. PD-L1 expression is down. This is, in some sense, what is being targeted with immunotherapy, that this form of biofield therapy is having that similar effect. We're seeing a decrease in inflammatory cytokines. We're seeing a decrease in parts of the immune system that stimulate cell growth. Here you saw, as we saw in the kidney cancer, macrophages, infiltration of macrophages in the tumor microenvironment lead to progression of disease, a reduction in infiltration of macrophages when the mice were exposed to biofield therapy. And in the most recent data that has not been in print yet, but has been accepted for publication, you see pictured here, which is the necrosis, level of necrosis, so essentially dead cells, much higher in the biofield therapy group compared to the control group. And importantly, reduction in stem cell markers. So chemotherapy, and we don't want to get into too much detail because I'm over time now, but chemotherapy is really good at killing the primary cancer cells, but not so good at killing stem cells. And stem cells tend to survive and then are able to, specifically cancer stem cells, and then over time end up leading to recurrence of disease. Here we see that this form of treatment Sean's using actually decreases stem cell markers in the tumor microenvironment. And although what you're looking at now is what we call somewhat anecdotal, looking at the behavior of the animals, you see the control animals, and you see that these are, happy mice, they're running around. And what we see with Sean's animals is something very different. The animals are not running around. The animals tend to stay clumped up to the front. And although I was the one shooting this, and my kids who have very scientific minds, the first thing that one of them said is, well, but your head's not up against the other cage. Yes, that's true in this visual, but then we took this further and we actually mounted GoPros behind the boxes and actually filmed what was going on. And in fact, with behavioral observation, we see there was dramatically reduced movement in the experimental animals, both during the first half as well as the second half. All the animals tend to calm down over time, but much more so. So we weren't able to put this in the publication because they didn't like the word consciousness, but the animals are somehow conscious that something is going on. They're conscious that something is changed in their environment. And we can call it prana because we don't know what to call it. We didn't measure it, so we weren't allowed to call it anything. But hopefully in time, we will be able to measure this phenomena that I believe is taking us deeper into the world of yoga. So just before closing, I thought I'd make a plug for an advertisement for a future talk that I'm giving with Allison, who you see pictured here, on July 24th, 12 to 1 Central Time. And here we'll get deeply into the mix of six, each of the 6 areas, just touching on the more physical side, pranayamic side of yoga, but looking at it all as yoga with a capital T. So in closing, I would like to bring up Vanda again from her wonderful book, Awakening the Spine. And when she's asked about yoga, she really understands yoga as this yogic way of life, that it's a living process that changes moment by moment, watching when we eat and how we eat, when we walk, how we walk, what we say and how we say it. All of these things are in us, and we must be passionately interested in them all. Thank you. Happy to answer questions, and sorry for going over. This is...
Thank you, Dr. Lorenzo Cohen. That was such a thorough, informative, and an enlightening talk. So it really did what we call as weaving it all together. Whenever we talk about cancer or many other diseases, there is this point of there is only certain things we can do to, prevent, or things could have been different. But your talk really brought out the importance of everything, from the role of chronic stress on cancer, tumor microenvironment, social health, social engaging, to prana, chi practices, everything wonderfully all woven together. Thank you so much for that wonderful talk. And comments and questions, wishes have been pouring in from all parts of the world. People are definitely engaged and intrigued by actually how much we can do to prevent cancer, which is, I think, a lot of us don't realize that there is so much. And if I can quote, I've heard you say many times that more than 50%, 70%, according to some studies, there are chances that so much of cancer can be prevented if people take care of their living and the lifestyle habits that are important. We do have questions coming in, which I'll take a few questions and see. Again, a lot of compliments and comments. The study on solitude, did the researchers actually check if their subjects were introverted or extroverted by nature? And
so great question. That's the exact question that I asked. It's like, well, I'm very introverted, and it was, let's say, somewhat distressing to read this data because I need to engage more, and this is something that I learned. And I have very close connections with family, with friends, but I'm introverted, so I feel uncomfortable having to engage a stranger in public. And they looked at that, and they actually found it didn't make a difference. You would hypothesize that it would be more stressful for the introverted and be less healthy for the introverted, but that wasn't the case. And so us introverts need to work on that. We need to work on overcoming this fear, and because perhaps they didn't find any effect, but it may be even better for the introverts because we tend to not form as naturally these connections. And I immediately thought of my extroverted friends and shared this, and they're like, yeah, now I know. I always feel so good when I engage with strangers and get to know them and create this even 5-minute connection at a coffee shop, etc. So they measured it very briefly, but they measured the 5 big personality characteristics, and it really had no effect. Great question.
Wonderful, thank you. There is another question on the Ayurvedic Prakritis, and I will just present it, and if you seem appropriate and comfortable in answering. So there was a paper on genomic basis of the 3 Ayurvedic doshas or Prakritis in a scientific report. Do you think the 3 doshas respond differently to yoga and meditation?
Well, that's a good question. I mean, we've tried to study that a bit more in traditional Chinese medicine, looking at the diagnosis and whether you would prescribe different practices. The Tibetan tradition has the similar concepts. And we don't know. I think the answer is just we don't know, and we can and we should. We can and we should do that research. And I think from an Ayurvedic perspective, the answer is, of course. Not everyone with a certain condition should be eating the same food and doing the same yogic practices. And when you look at the different characteristics of an individual from the Ayurvedic perspective, it is clear. I mean, those who know Ayurveda don't even need me to tell you what my character is. You know, just from my body type, my voice, the way I look. And I shouldn't be theoretically prescribed the same diet as somebody who's my polar opposite. But it just hasn't been researched. So I think there's so much opportunity. And they don't have to be, you know, these large, randomized, massive trials. It can be these little experiments that are done in particular places like Prashanti, where you have the ability to have people you know, living there, and to be able to look at what happens after a month of in this way for this particular personality type. However, the challenge is that, you know, in general, doing, let's say, you know, the yogic practices on a daily basis, pranayama, meditation, asana, eating a primarily vegan diet, and doing moderate amounts of physical activity every day, that if you do that, regardless of what your personality characteristic is and dosha imbalances, I'm guessing that you're going to have improved health no matter what. So getting really fine-tuned, this dosha versus that dosha, it may be hard to find an effect because the general effect is so powerful of a yogic way of life.
Thank you. And also to mention for our viewers, we have had panelists from the field of Ayurveda, and combining yoga and Ayurveda in the therapeutic setting also have presented different talks. So I strongly encourage to go and take a look at those as well.
Now, when we're talking about herbs and supplements, totally different world. I think that, you know, you don't take, well, one, you don't take an herb, or you should not take an herb or a supplement without the guidance of a professional, whether that professional be from the Ayurvedic tradition or the Western tradition. But when it comes to that, I could see more of the need for that individualization.
Thank you, Dr. Cohen. We also have Dr. Akila Reddy's father-in-law saying hello to you. We have people from Scotland sending hello, from Miami, from all different parts, people sending wishes, and really appreciating all the information that you have mentioned. There is also a comment/question where one of our audience is asking that such studies are less or missing in India on the therapeutic applications. And if I can say that Dr. Lorenzo mentioned initially, where SVSA, Bengaluru, the Prashanti Kotiram colleagues and group have been doing yoga therapy research for decades now, and so are many other organizations that are contributing. Anything that you would like to add, Dr. Cohen?
I just think, I mean, I think we're it's totally different today than it was even 5 years ago. You know, Smita, you've been there?
10 years.
10 years now. I've been at MD Anderson over 20 years, and it's just a different hospital now when it comes to what we're talking about. You know, the Integrative Medicine Program has been offering yoga and acupuncture and mind-body and a comprehensive approach to cancer care for quite some time now, but there hasn't been as much of a universal, let's call it, buy-in. And that's because the evidence is just, it's overwhelming. The evidence for the harms of stress, the evidence for the benefits of engaging in, again, I'll use this term, this yogic way of life. I mean, we are it's just irrefutable that leading a more plant-centered, stress-free, exercise-filled life leads to improvement, not only in length of life, which of course is important, but if you're miserable, why would you want to have a long length of life? But it improves your quality of life and improves every aspect of your being. So I think that we are going to see, I think, quicker now because of what everyone is experiencing and all the data that's pouring in, that's going to also reinforce that those who are vegetarian and vegan probably do better when they get the virus and have a lower probability of having poor symptoms of COVID-19. Those who exercise more have better outcomes. When the vaccine starts to come, we know that chronic stress interferes with response to vaccination. There's slower seroconversion of that vaccine. So you would need, people who are low stress leading the yogic way of life are going to convert at that first injection, and hopefully we need just one. But for many, that you have to have repeat injections for some vaccinations. And those who are leading a yogic way of life are going to respond better and faster. We have stronger immune function. We decrease inflammation. So this is hopefully now going to be clearly understood and be part of medical care. It's not just about pills, but it's teaching people how a healthful way of living.
Thank you for reinforcing the point again, the role of mind, no matter even the diet, exercise. Of course, the synergy is better, but the role of mind is greater, especially when combined. We have another participant asking, are there research on the benefits of yoga for non-Hodgkin's lymphoma patients to support them during immunotherapy treatment?
During immunotherapy, the answer is no. I haven't seen actually any yoga studies yet on the role of yoga alongside immunotherapy. We did actually the first yoga study that I published back in 2004 was with Tibetan yoga. And that was with both Hodgkin's and non-Hodgkin's lymphoma patients, and showing improvements in particular sleep outcomes, but other aspects of quality of life. That's going to be a fascinating question to ask, which is the role of yoga and other mind-body practices to increase response to immunotherapy, because we know that again, in particular, if we are focusing on yoga as a way of life, we know that it's going to improve multiple aspects of the immune system and therefore lead to better response to immunotherapy. But nobody's done it yet, so now is the time. We have a large cohort of melanoma patients. Interestingly, that 2 years ago, I ended up signing a consent form for my own study, for which I was the PI. So I'm part of this melanoma database where we're measuring stress, we're measuring social support, diet, exercise, and importantly, the microbiome, the immune system. And so we'll at least see from the epidemiological perspective what is the role of these factors in predicting outcome. There's no question, and we have hopefully a paper coming out in Science in the next few weeks, a month at the most, showing clearly that the microbiome predicts response to immunotherapy. And the patients who had the highest amount of fiber in their diet, meaning they were eating a lot of plants, had the healthiest microbiome and almost a 5-fold increased probability of responding to immunotherapy. Now we're going to start to look at stress, but it's a whole different talk. But we know that stress innervates the microbiome, making it less healthy. Yes, a super exciting area of research to look at lifestyle and response to immunotherapy.
Thank you, Dr. Cohen. Another question, I know we have quite a few more, but to maybe take one or two more, we have a participant who is asking, this plan looks great to prevent cancer, but what if I already have cancer or I have survived cancer? Would this still work? And how do we know, where do we start?
Well, the last bit you slipped in is the hard part. The first part of the question is easy to answer, which is, in fact, most of the data that we have on lifestyle, in particular when it comes to interventions, is with cancer survivors, defined as from the day of diagnosis. So there's no question that diet, exercise, sleep, and stress and social support influence outcomes after a diagnosis of cancer. It's harder to actually do the research making that link as an etiological factor, meaning the primary risk factor. So a lot of people I know think that stress causes cancer, but there's not a lot of data to show that stress actually causes cancer, meaning the initial mutation. But stress is linked with all of, again, the cancer hallmarks, which allow a cancer to grow and thrive in the body. So it's especially important for those who already have cancer to engage in the mix of six. And where you start, hopefully you can join 10 days from now on later in the month, where we get more into details of this. But you start with social support. You must start with social support because you know the stress is bad, you know the exercise is good, you know that being vegan is better than being an omnivore. And so you go and you start doing those things, but you don't have the support to make it sustainable. And so you start with love and support and your community, and then you bring on these other areas. The more you do, the easier it is to engage in each of them. So I tend to be an all-in kind of person. Allison, will share with the listeners that, she'll bring on one at a time, start to manage it, and then bring on the next component. So there's no right answer, except guaranteed you got to start with social support. Get your community backing you so that you'll be successful.
Excellent. Dr. Cohen, one last question, and then maybe we can redirect some of these questions later. But how do we convince our family, friends, or anybody who is impacted by cancer to start practicing yoga or get them on a yoga journey?
Well, I was trained as more of a behavioral psychologist and not clinical. So I would tend to defer this to my clinical folks. I tend to be very analytical, and to me the data matters, and we should be driven by science, and we're seeing that more than ever right now. That if people in all countries had just followed the basics of what the scientists said and doctors we needed to do, no country in the world would be suffering the way they're suffering today. Because there's very simple solutions to, difficult but simple solutions to controlling a pandemic. I mean, we can go to the moon and back safely, and we're going to do it again, and we can do it multiple times. We can split the atom, but we can't seem to control our own behavior at a fundamental level. And that's a whole other talk, as why people are being so resistant to the knowledge. So this may say I'm, arguing against myself that all we need is people to be aware and know the science. Obviously, that's not enough, but we have to have that. And so, the evidence needs to speak for itself. I think, the kind of bargain you can make with people who are somewhat skeptical is just try it. Do me a favor, try even just a week of yoga. Ideally, you would do it for a bit longer. We see, with MBSR, it's an 8-week program. Some of our yoga programs are 6 weeks. And we see just in that short period of time, very, very noticeable changes in the person's quality of life. They'll report that they're sleeping better, etc. So, we can't force people to do things, but we can encourage them to try it. And as soon as you try it, and you're mindful, your body speaks to you, and your body says, why haven't you been doing this forever? And hopefully that ends up being the hook.
Thank you. Thank you so much, Dr. Cohen, for answering all our questions. And I don't know if our viewers have noticed, a part of walking the talk, keeping yourself physically active. Dr. Cohen has been standing for the past 1.5 hours while he's giving this talk, happily engaging and giving the exercise to his body. There are other questions that are along the lines of, fasting, diet, nutrition, different populations and things like that, which is probably another session, or if people start following some of the work that you have been doing. And we also on Indica have a interview article that is published knowing the work of Dr. Cohen and the areas that he has worked. So I strongly encourage you to go take that as well. So with that, Dr. Cohen, we have a couple announcements to make, and then we will come back for the last parting message for all our viewers today. So just stand by for a couple minutes. I request Vinay Chandra, Dr. Vinay Chandra to.
Thank you, Dr. Cohen, for this highly illuminating presentation. Thank you very much. When we set out with this festival, we had this very clearly in our mind that we'll explore the concept of wellness from different domains, from spirituality to science, from philosophy to practice. So we wanted to cover all these 4 approaches, and your presentation is extremely valuable, especially looking at evidence-based approach towards integrating yoga with care and with treatments, and in fact, allowing the way for the future of integrative medicine. So thank you very much for that. So with this, I would like to just make a couple of announcements for tomorrow. I request Srinivas ji to kindly present us the post events of tomorrow. So tomorrow morning, we have a session by Dr. Richa Chopra ji, who is a senior international faculty of Art of Living, who will be speaking on yoga psychology, a pathway to mental well-being. So it will be again an excellent session on focusing on the contributions of yoga towards psychology. So please, I request all of you to join us for this session. And in the noon, we have a session by Dr. Ananda Balayogi Bhavanadi, who is the director of Center for Yoga Therapy Education and Research, and also the director of Sri Balaji Vidyapith University, Pondicherry. He will be speaking on yoga therapy or yogapathy, especially just approaching therapy in terms of symptomatic management could be merely yogopathy if the root cause of the disease is not addressed. So that will be the subject of his presentation. Is it yoga therapy or yoga therapy? What are we providing as yoga therapists? So he'll be exploring that question. And in the evening, we have Dina Merriam, who is the founder and key convener of Global Peace Initiative of Women based out of USA. She'll be speaking on Vedic deities and their relevance today. So I welcome you all to join us for all these sessions and also continue this journey along with us. And I want to share this good news that we have extended this festival up to 31st of July because of the response we were having, because of the lineup of speakers that we are having. We really couldn't stop it at 20th July as we had decided earlier. So this journey continues till the end of this month. So please stay with us and also follow us and be the ambassadors of wellness, which needs to be the focus of the hour, shifting away our attention from the illness and the pandemic discussion that is happening everywhere. So with this request, and also to let you know that for those who have joined us today, all these talks have been recorded and they will be available on Indica Yoga YouTube channel for free. And the details of these sessions, the future events are also available on Indica Yoga website, that is www.indicayoga.com. So I urge you to all look into the website, mark your schedules, mark your calendars, and do join us for all these events. We still have about 20 days to go. So with this, I now get back to Smita for being an excellent co-host of this session, and to Dr. Cohen.
So Dr. Cohen, in today's session, you helped us explore and look from a physical practice of yoga, a movement, asana, all the way to the prana practices, to the mind practices, to the purpose of life. So there has been an enormous interest from all the participants to follow your work and to maybe, if possible, get in touch if needed. So is there a way that particularly patients, people can, follow your work or reach out to you?
Well, on social media, on Facebook, I'm at Lorenzo Cohen, Dr. L. Cohen. On Twitter and on Instagram, we have I guess a name which is Anti-Cancer Living. And at MD Anderson, it's easy to find me there as well if you want to reach out directly by email.
Thank you.
And again, on the 24th, a week this Friday, you can learn more about the mix of six through the Baylor lecture that we'll be doing.
I strongly urge participants who are interested in learning about the mix of six and how it relates to every area of cancer prevention to check out the flyer that Dr. Cohen shared and join the presentation. So as we come to the ending part of today's presentation, we want a message from you, a parting message for all our viewers and listeners to take away from your talk today.
I guess, to keep it succinct and the key point, that we say this in our book, Anti-Cancer Living, is that self-care is true healthcare, and greater wellness is available to all.
Excellent. On those words and on the words that Dr. Cohen presented on the last slide from Wanda, every moment, every moment of life is a conscious process and evolution. So every moment is yoga. So with that, Dr. Cohen, our heartfelt gratitude for sharing your most valuable, precious time with Indica Yoga and all the Indica friends, followers, and family across the world. We truly appreciate and we look forward to greater collaboration in future as well.
Thank you all.
Thank you, Dr. Cohen. While we express our gratitude to you, we also would like to place on record our gratitude to your grandmother, Vanda ji, for preparing you or giving you this orientation. I think that was the icing of the cake, as many of our participants also mentioned. We are all grateful to her.
Thank you. Thank you.
And also, Smita, thank you very much for excellently conducting the session. And I would like to tell all our participants that Smita ji led a session on wellness in cancer care, from surviving to thriving. So the recording of that excellent presentation is also available on Indica Yoga YouTube channel. So kindly connect with it, follow it. You can also see both this presentation together and it makes much, much more sense. So with that, I thank both of you and I thank all our participants who have joined us this evening. Namaste and good day to all of you.
Thank you.
Namaste.